Have you heard the buzz about Ozempic? It's the weight loss secret that's turning heads everywhere. From Hollywood A-listers to everyday people, stars like Sharon Osbourne, Amy Schumer, and Oprah Winfrey are raving about it. But what's really behind the hype? Before you dive into this trend, ask yourself, have you considered the side effects you never expected? Are the potential risks worth it? In this video, we'll uncover 13 side effects of Ozempic that might just change your mind. Stick around until the end because the last side effect is something you probably never thought of. Before we dive into the side effects, let's understand how Ozempic works. Ozempic is a game-changing medication designed to help people with type 2 diabetes manage their blood sugar. But here's the twist. It has also skyrocketed in popularity for weight loss.
We're seeing double the amount of weight loss you can achieve with this class of medications compared to what we've had in our toolbox for the last several decades, in combination, of course, with a healthy lifestyle.
So what makes it so effective? Ozempic mimics a hormone called GLP-1, which targets specific areas of your brain to reduce your appetite, slow digestion, and help you feel fuller for longer. It has helped many people shed weight quickly, making it a hot topic among American celebrities and influencers who are looking for rapid weight loss solutions. However, like any powerful tool, Ozempic comes with its own set of side effects.
If you're on Ozempic type drugs, they can slow down your intestines. They can predispose you.
Number 1. The terms Ozempic face or Ozempic butt describe how some people might look after losing a lot of weight quickly with Ozempic. It refers to the appearance of sagging or wrinkled skin that can develop on the face and buttocks. As fat is lost from the body, the fat in the face also reduces. This leads to a more pronounced bone structure and sometimes a more aged appearance. Ozempic works by reducing your appetite and slowing down gastric emptying, resulting in a significant reduction in body fat. Studies show that patients using Ozempic lose an average of 5 to 10% of their body weight over a year and 14.9% over 68 weeks. This quick fat loss can sometimes cause loose, sagging skin because the skin may not have enough time to retract tightly around the newly reduced body volume. The skin's elasticity may struggle to adjust to the changes in body shape, especially in areas like the face and butt, where significant weight loss can be visually obvious. This means that people who lose weight from Ozempic might find themselves looking older than they actually are. However, the appearance of sagging skin could be managed to some extent by taking a more gradual approach to weight loss. Number 2. The side effects of Ozempic go beyond sagging skin. There could also be kidney problems. A study found that Ozempic reduced the risk of major kidney disease events by 24% in patients with type 2 diabetes. However, while Ozempic has shown benefits for kidney health in some studies, there is still a chance it can impact your kidney function. It can cause issues such as acute kidney injury and worsening of chronic kidney disease. Why does this happen? Using Ozempic may lead to gastrointestinal side effects, such as nausea, vomiting, and diarrhea. These side effects can cause dehydration. When your body loses fluids and isn't adequately replenished, your kidneys struggle to filter waste from your blood, which can lead to acute kidney injury. Additionally, rapid weight loss can stress the kidneys, especially in people with pre-existing kidney conditions. So, while using Ozempic, make sure to stay hydrated to manage this risk, particularly if you experience gastrointestinal side effects. Number 3. Another side effect that Ozempic could cause is an increased risk of thyroid cancer. But before you get scared, let's break this down. The concern about Ozempic raising the risk of thyroid cancer comes from animal studies. In these studies, rodents exposed to semaglutide, which is an active ingredient in Ozempic, developed tumors in their thyroid glands after long-term exposure. However, what happens in mice doesn't always happen in humans. The evidence in humans is much less clear. In fact, while some research suggests a possible increase in risk, the numbers are very small. For example, a study showed that the relative risk of thyroid cancer in patients using Ozempic could increase by no more than 31%. Ozempic works by stimulating GLP-1 receptors, which are also found in the thyroid. The thyroid is a small gland located in the front of your neck. It helps control many functions in your body by producing and releasing certain hormones. In animal studies, prolonged stimulation of the receptors in the thyroid appeared to lead to tumor formation. However, scientists are still trying to determine if this happens in humans the same way. To be safe, don't use Ozempic if you or anyone in your family has ever had a type of thyroid cancer called medullary thyroid carcinoma. Number 4. Gallbladder problems may not be the first thing that comes to mind when you think about Ozempic, but they're definitely something to be aware of. Ozempic has been associated with gallbladder issues like gallstones, also known as cholelithiasis, and cholecystitis, which is the inflammation of the gallbladder. This happens because of Ozempic's ability to help people lose weight quickly, and rapid weight loss can actually increase the risk of developing gallstones. When you lose weight quickly, your body starts releasing more cholesterol into your bile, and that extra cholesterol can form hard stones in the gallbladder. But that's not all. Studies have shown that Ozempic can also affect your cholesterol metabolism by increasing cholesterol levels in the body. This means that your gallbladder has to work extra hard to break down all that excess cholesterol, and over time, this can lead to the formation of gallstones or even gallbladder inflammation. However, the good news is that these gallbladder issues are considered relatively rare. According to studies, the incidence of gallbladder-related problems in people using GLP-1 receptor agonists like Ozempic occurs in about 1 in a few hundred patients. However, it's essential to consult your doctor if you experience any problems while using Ozempic. Number 5. Let's move on to a side effect that might surprise you: hair loss. It's important to note that hair loss is not a direct side effect of Ozempic itself. Instead, it's more related to the rapid weight loss that can occur when using this medication. This type of hair loss is called telogen effluvium, and here's what it means. When your body experiences something stressful, like losing a significant amount of weight quickly, it can cause hair follicles to enter a resting phase, known as the telogen phase. During this phase, more hair falls out than usual. When the weight comes off too fast, your body prioritizes energy for essential functions, such as keeping your organs running, while directing less energy toward non-essential processes like hair growth. As a result, you might notice more shedding than usual. A study indicated that hair loss was reported in 6.9% of patients taking semaglutide, the main component of Ozempic. However, the good news is that this hair loss is usually temporary. Once your body adjusts to the weight loss, the hair growth cycle should gradually return to normal over time. Number 6. Nausea and vomiting are among the most common and frustrating side effects of Ozempic. About 1 in 5 people using Ozempic experience these symptoms, making it a significant challenge for many users. Even celebrities like Amy Schumer have shared their experiences with nausea while using Ozempic for weight loss. This side effect can affect a patient's ability to continue using the medication.
And I was one of the people that felt so sick and couldn't play with my son. I was so skinny, and I was just like he was throwing a ball at me, and and you're like, okay, this isn't livable for me.
So why does this happen? Food stays in your stomach longer than usual due to Ozempic, which can make you feel overly full and trigger nausea and sometimes vomiting. But that's not all. Ozempic also activates specific receptors in your brain that can contribute to that queasy feeling. Statistically, nausea tends to appear in patients using Ozempic within the first 8 to 12 weeks of starting the medication. While most people only experience nausea, about 5% to 9% of patients may end up vomiting. If you're experiencing nausea and vomiting, the good news is that for most people, these symptoms are temporary. However, if they become severe, make sure to consult your doctor. Number 7. Pancreatitis is one of the serious side effects that Ozempic could have on the body.
If you're going to go on the Ozempic type drugs and you get intestinal pain, you get stomach bloating, you get pain, you drink alcohol with this, you're predisposed to intestinal obstruction and pancreatitis.
It's a condition where the pancreas becomes inflamed, leading to severe abdominal pain and potentially life-threatening complications if not treated quickly. So how can Ozempic cause this? One way Ozempic works is by stimulating your pancreas to produce insulin. For most people, this is beneficial as it helps control blood sugar levels. However, if your pancreas is already vulnerable, perhaps due to a history of pancreatitis, high triglycerides, or excessive alcohol consumption, this added stimulation could push it over the edge and lead to inflammation. A study found that about 5 out of every 1,000 users of semaglutide drugs, like Ozempic, developed pancreatitis, which is higher than the 1 out of 1,000 users of other weight loss medications like bupropion naltrexone. However, while it's not common, it's still something to watch out for. Symptoms of pancreatitis can be very intense. They often present as severe pain in your upper abdomen that might spread to your back, along with nausea or vomiting. If you're taking Ozempic and notice these signs, it's crucial to seek medical help right away. Number 8. Gastroparesis is the next side effect we'll discuss. This condition occurs when your stomach takes too long to empty its contents. You might experience symptoms like nausea, vomiting, bloating, or abdominal pain because the food just sits in your stomach longer than it should. Ozempic works by slowing down gastric emptying, which is part of how it helps control blood sugar and keeps you feeling full longer. For most people, this is helpful. However, in some cases, the slowing effect can go too far and lead to gastroparesis. A recent study showed that people taking GLP-1 drugs, such as Ozempic, were 66% more likely to be diagnosed with gastroparesis than those who weren't. So, how do you know if you're experiencing gastroparesis? If you're feeling full for a long time after eating, experiencing nausea, vomiting, or having bloating and abdominal pain, these may be signs that your stomach isn't emptying properly. If you notice these symptoms while taking Ozempic, it's important to talk to your doctor. The good news is that gastroparesis can be managed. Your doctor might adjust your Ozempic dosage or suggest changes to your diet, such as eating smaller, more frequent meals to help your stomach process food more easily. Number 9. Hypoglycemia, or low blood sugar, is a side effect that can sneak up on you, especially if you're taking Ozempic alongside other diabetes medications. Hypoglycemia can feel scary, with symptoms like shakiness, sweating, confusion, and in severe cases, it can even lead to passing out. On its own, Ozempic doesn't usually cause hypoglycemia, but when combined with other drugs like insulin or sulfonylureas, both of which lower blood sugar, the risk goes up. These medications work together with Ozempic, sometimes pushing blood sugar too low. A study showed that the occurrence of severe hypoglycemia in people using Ozempic was less than 1.5%. However, when insulin or other diabetes medications were introduced, the incidence of hypoglycemia could rise as high as 11%, depending on the dosage. What this means is that if you're on multiple medications for diabetes, you should be cautious about this potential side effect. It's all about balance. Check with your doctor for managing your blood sugar without letting it dip too low. Number 10. Angioedema is another rare but serious side effect of Ozempic. It involves swelling beneath the skin, most commonly around the eyes, lips, and even the throat. The worst-case scenario is that if the swelling blocks your airway, it can become life-threatening, making it hard or impossible to breathe. Angioedema is usually an allergic reaction triggered by your immune system's response to Ozempic. When your body reacts negatively to the medication, it releases histamines and other chemicals that cause this swelling. In a study involving nearly 29,000 people reporting side effects of Ozempic, only 47 experienced angioedema, indicating that it is a pretty rare side effect. However, the chances of experiencing this side effect increase in females over 60 years old who have been taking Ozempic for less than a month and have type 2 diabetes. So, if you're taking Ozempic and notice swelling around your face or throat, seek medical help immediately. Number 11. Ozempic babies refer to unexpected pregnancies, often occurring in women who were on birth control or had previously struggled with infertility. Unplanned pregnancies among women taking Ozempic have become a surprising topic of conversation on social media. So, how does this happen? It turns out that Ozempic's ability to slow digestion affects not just appetite, but also the absorption of oral contraceptives. Because birth control pills need consistent absorption to work properly, the slowed gastric emptying caused by Ozempic can reduce their effectiveness. Additionally, Ozempic often leads to weight loss and metabolic improvements, which can boost fertility, even for women who thought it wasn't possible. There's no clear number on how many Ozempic babies are out there, but the trend is widely discussed on platforms like TikTok, where women share their experiences of surprise pregnancies despite being on the pill. Health experts strongly recommend considering other forms of birth control if you're taking Ozempic. It's an unexpected side effect, but it's essential to be aware of it and plan accordingly. Number 12. Diabetic retinopathy is a serious complication of diabetes that affects the eyes by damaging the small blood vessels in the retina. Over time, high blood sugar can block these tiny vessels, cutting off the blood supply to your eyes. In response, the body attempts to grow new blood vessels, but these new vessels are often weak and leaky, which can cause vision problems and even lead to blindness. While Ozempic helps control blood sugar levels, it can actually cause a temporary worsening of diabetic retinopathy, especially if blood sugar improves too quickly. This phenomenon is known as early worsening. When blood sugar levels drop rapidly, it puts stress on the already fragile blood vessels in the retina, increasing the risk of leakage or other complications. A study showed that patients on semaglutide, the active ingredient in Ozempic, had a 76% increased risk of diabetic retinopathy complications compared to those who weren't using it. Another study indicated that about 10 to 20% of patients using Ozempic, especially those with advanced retinopathy, experienced a worsening of their condition. This means that if you already have diabetic retinopathy and are starting Ozempic, it's crucial to monitor your eye health closely to prevent long-term damage. Number 13. One of the biggest concerns for those taking Ozempic for weight loss is the possibility of regaining weight after stopping the medication. Unfortunately, this is a common experience because the underlying behaviors and metabolic changes that led to weight gain in the first place may resurface once the medication is discontinued. While on Ozempic, you feel fuller for longer and experience fewer cravings due to the drug's effects on digestion and appetite signals. But when you stop taking it, those effects fade. Your appetite returns, old eating habits can resurface, and it becomes much harder to maintain the same level of control over food intake. Moreover, after significant weight loss, your metabolism tends to slow down, making it easier for the weight to creep back on. A published study revealed that people regained 2/3 of the weight they lost within a year of stopping Ozempic. In another study, about 50% of the weight lost returned within the first year after discontinuation. This means that if you plan to take Ozempic for weight loss or stop using the drug, it's essential to have a long-term plan for maintaining your weight. Are you struggling with fatty liver? Check out our next video to discover 14 natural ways to reverse fatty liver at home in just 90 days.